Hi, this is Dr. Mike Jurgelewicz, functional medicine practitioner, and I wanted to spend a few minutes and explain to you how my office is different than some of the offices that you may have visited before, and you may have a few questions on what exactly functional medicine is. So, I got introduced to functional medicine in 2004, and functional medicine is this patient care centered approach that focuses on the underlying cause of chronic disease using a systems oriented approach instead of an acute care model that focuses on disease maintenance and symptom management. So, in conventional medicine, we have many specialties that dig deep into certain areas. However, they treat each area independently of each other. Now, from a functional medicine perspective, we recognize that our body is made up of this complex interconnected web of biological systems, and they need to be treated simultaneously as a whole. So when I have my intake forms that are about 25 pages, as well as a 7-day food diary, we can really look deep into some of these underlying health issues. And many people may list 5 or 7 health concerns, and they don't necessarily have all these different individual problems, but a lot of these things are interrelated. So by shifting away from this traditional disease centered model, we can really focus on the whole person instead of an isolated set of symptoms. And it allows us to spend more time with patients. And we can really look at some of the interactions between genetic and environmental influences and lifestyle factors that really play a role in this chronic disease process. And it's important to note when you look at really the medical research that there's this large gap between research and the way doctors practice. And what you see in the medical research today may not even turn into what happens in clinical practice for up to 50 years. So, functional medicine uses the science as well as some advanced laboratory testing, specialty lab testing, as well as traditional lab testing, as opposed to some of the limited labs that my patients are typically used to using. And we're able to really see where your physiology is not functioning optimally. So, we know that we're all metabolically different and our bodies react to different conditions in different ways. And when you have chronic conditions, we typically have increased nutrient demands or more metabolic demands than what can be achieved typically in the diet alone. And so, really, the name of the disease matters less as we understand the cause of the dysfunction. So, the treatment really needs to be matched to the cause and not the disease.